Good evening. Hope you guys had a good day. I had a very long day. I am very tired. It has been pouring rain. It has been super cold and the vibe is just not there. So today I am not in the mood of doing nails. I actually did my manicure yesterday. I didn't remove a lot of my sparkly stuff. I kind of just filed down as much as I needed to give myself a fill. Um, but yeah, I don't feel like doing like a whole lot today. I took like an hour and a half nap, which is very long. Right now I'm having trouble falling asleep. So I made a quick run to Walmart, picked up a few things that we need for the weekend. And then I said, let me get home. I picked up some Lego sets. As I mentioned in my first video, for every video, I try to keep myself busy. It's part of my therapy. It's therapeutical. It's not like a mandatory thing. I just find that when I do something like this, whether it's building Legos or coloring or doing nails, which again, I'm not a licensed nail technician or artist or whatnot. I'm not a doctor. I'm not a psychologist. I'm not a therapist. I am not licensed for any of that. Everything I say and share is just my experience with these sort of topics, and just want to shed light on a lot of things too out there that a lot of people don't talk about, and just encourage people to speak up and share their story. It's every time I get on this camera, I feel so vulnerable because a lot of my childhood trauma is very sensitive. But I also believe and feel and know for certainty that every time I share outside of my safe place, which is therapy with my therapist, I feel this sense of relief, and I feel this, like this weight lifted off of me and this freedom just come through. So, I don't know. For years, I have always thought like, dang, what if I share my story? It's always been in the back of my head, just sharing, but I've never had an opportunity, or there's never been the right moment because I've not been working on things. I've just been kind of there, like, what if I take it out? But it's like, I've never been ready to, because I've never really sort of addressed anything with an actual professional that would help me sort of, put things, how can I say it? That can help me sort of unravel things and understand each thing, each trauma. Rather than me just telling people, right? You can tell people, oh, I went through this, I went through that. But, it's one thing telling someone and sharing your story. There's another thing sharing it with a professional who can help you understand certain things and see things from a different perspective where you're able to heal. I not only have childhood trauma that has affected me emotionally and mentally, but I also have PTSD, generalized anxiety, which, create other challenges for me now as an adult. So, with that being said, I've had 2 years of therapy, and I am extremely happy that I went ahead and did that. But this next video is about my hysterectomy. For my endo warrior sisters that have been curious about my experience, I wanted to sort of tap into that and share with you what my experience was like. And I don't know, maybe it can help you. It could just shed some light on that. I know there's a lot of information out in the internet, and prior to me getting my hysterectomy, even like a year or two before actually booking it, I myself got on YouTube, got on Google, and I started just looking for other people's experiences. And I started to sort of research the information because, doctors, they're just going to tell you all the general operative, procedure and all of those, nuances, right? They're not going to tell you, well, this is what I felt, no, of course not, right? So, given that I wasn't just going in for a hysterectomy because for no reason, I was going in for a hysterectomy because of my endometriosis. For those who do not know what endometriosis is, it's, probably the worst chronic disease. It's debilitating chronic inflammation and pain for mostly women in the pelvic area. So the way my doctor prescribed it is, you have bleeding on the outer lining or inner lining of the uterus. So kind of seemed to understood that I was having like an internal period. I also had adenomyosis prior to my uterus being removed. So that was probably the biggest pain factor for me. And I will get into that in a bit. But I will drop a link for those who don't understand what endometriosis is. If you're suffering or you think someone is suffering from endometriosis, because it's not a very well talked about chronic disease, especially in the kind of gynecology industry. I had my gynecologist at one point say, hey, you're in pain. I can't help you. There's no cure. There's nothing I can do for you. Didn't even have the proper education to point me to a direction where I could see a specialist or even understand this more thoroughly, other than like, here, take painkillers, I don't know. I can't help you. And so that was truly devastating. That was just, I felt defeated. And that is when I said, I have to advocate for myself and I need to find a way through this disease. And that all started 3 years ago when I first had my first laparoscopic surgery. It was a robotic where they went in and they formally diagnosed me because so unless you're seeing a specialist who can read your ultrasounds and understand and be able to identify endometriosis, they still can't say legally you have it unless they go in there and they see it. But a specialist should be able to somewhat get an idea and be able to say almost for a fact that that is endo. Most gynecologists won't. They won't say it unless they can suspect, they can, think, but they won't say, you have endometriosis unless you go through the surgery. And obviously in that same surgery, they will probably remove adhesions and, any cysts, fibroids, polyps, and anything that is obviously causing, trouble for you with endo, then, they address it then as well. So for me, I had been suffering with endometriosis since maybe my teenhood. I think it was maybe my sophomore years when I started to experience a lot more menstrual pain, like just terrible menstrual pain. Just something where you almost just could faint. I remember once I nearly passed out. I asked my parents, you have to take me to the ER. I don't feel good. I'm like in just so much pain. I couldn't walk. So they didn't really do very much for me. They just kind of send you home like, here's some pain meds and yada yada, right? Maybe you have a cyst or, possibly cyst rupture, but no, with, ultrasounds and all of that, that wasn't the case for me. But I lived like that. So up until maybe my mid 20s, early to mid, maybe mid 20s is when I started to experience a ton of like severe pain where it started impacting my day to day. Like prior to that, maybe 1 or 2 days, I would probably stay home. Now, like I would have maybe 2 weeks out of the month where I would have to stay home and be in bed, crawl, because I was in so much pain. I couldn't walk, couldn't get out of my bed. I'd just be like in fetal position with so many bad cramps that would just like radiate down to my legs, nausea, all these other symptoms that are just, again, horrible to experience. But I remember I started to complain a lot to my gynecologist, like, hey, I'm in pain. I feel my right side of my ovaries, the left side of my ovaries. And so, I did some general ultrasounds and they're like, yeah, you do have some cysts, but they're not large enough to remove. Like, you'll be fine. But we do suspect that you may have endometriosis. And I was like, huh? Endo what? Like, I truly had no clue what it was. And I kind of just lived like that for like at least another, I don't know, 6 years or so. Like, just like, yeah, I'm in pain because I have endometriosis, but I never really cared to like study or like research or I was just like, I have endometriosis. But, nothing was done because my doctor did say, like, you have to have surgery. And I was just like, yeah, I'm not doing any surgery. I was like scared out of my mind to even think of like surgery at that time. And it almost like there was just months where it wasn't too bad. And I was like, this is just like a bad period. Like after hearing it so much and being gaslighted for nearly, 10 years or so, it's like you almost start to believe it, that it's not a big deal and it's just a bad period and we're women and we're supposed to just deal with it, because that's just how it was presented to me and sold to me for like so many years. So by the time when I had an actual doctor say endometriosis, and he was just so nonchalant about it. Like, yeah, it's normal, like you're good, it's fine. So that's why I was like, well, why would I like, and he wasn't even suggesting a surgery. He was just like, you can, but it's like, it's normal. Like, why would you go under, right? So that was kind of like my experience with that. And then I got married and in the beginning of our relationship we thought about like, conceiving and trying for children, and I noticed that I wasn't being successful. Went and did all of the, studies and testing and all the things that you would normally do when you're not being successful after a year of trying normal. And, both my husband and I went through that process. And, kind of ended up to like the step where you go to like the fertility doctor, right? And so, I was going under all of these treatments. It's kind of overwhelming to dive into it, but long story short, with that, it was very complicated, right? And I started to become very frustrated and overwhelmed and emotionally draining. So I kind of said, you know what, I don't think I can do this. Physically, when I met my husband, a little over 10 years ago, I was a lot more petite. And through that process of going through fertility and all of that, I mean, I had to be on so much medication and do all sorts of treatments, and that just really, it was hard on me. So I just started putting up a lot of weight. I still have it now. Luckily, I've lost a lot of it, but it really took a toll on me emotionally, mentally, physically, and I stopped trying. And in the middle of that, when I decided that I wasn't going to try anymore and just let things happen naturally if that was meant to be, I started to worsen with my endo symptoms. And I mean, it was just getting really, really bad. So I started to push more my gynecologist. And by the time I had been on like maybe my fifth gynecologist since my adulthood, because I was tired of always kind of getting the same response and not not a lot of help, not a lot of direction, not a lot of questions answered that made sense to me as to why I was dealing with what I was dealing, and just kind of understanding endometriosis. So I also wasn't taking no for an answer or any vague answers. I just kind of began advocating for myself, and that led me to my first surgery. And that only happened because prior to that first surgery 3 years ago, I went, I would say, about almost a year without a menstrual cycle. And when I saw a doctor and kind of said what was going on, they put me on some medication. I think it was progesterone, if I'm not mistaken. And I started to menstruate again, but I had it for almost 8 months nonstop. And I wasn't on any medication or anything like that, but there was just whole disruption with my cycle. I mean, as if it wasn't, you know, abnormal to begin with, right? So it just got really, really wonky. And I'm like, okay, well, now I'm starting to worry. I started to consider the endometriosis diet. You know, people swear by it. After doing a lot of research, I understood that, you know, that wasn't really a big factor, or a big big factor into change of what your circumstances are with endometriosis. It helps with the inflammation and that kind of thing, but it wasn't a treatment. My only option then was getting on like some kind of hormonal treatment, which I'd been on for so many years. And I was only getting bigger in weight, physically, and just more emotionally and mentally draining, because I'm very sensitive to medication. So that was just like not fun for me. But I got on it anyway. And then I just kept having just tremendous amount of pain. I mean, down to my hips, my inner thighs, my lower back. And finally, my gynecologist said, well, do you want to, we haven't formally diagnosed you with endometriosis, but I see in your chart that there's been a lot of suggestions that that's possibly what's going on. And, we could, schedule a pre-surgery where you can discuss it with someone in the surgical department. This person that I was referred to was not an endometriosis specialist, but had experience with, the robotic and the procedure itself. So at that time, I did not know that what I know now, that it's best to always see an endometriosis specialist. But I was still sort of like, in ignorant of the topic myself. Had been living with it for, almost 15 years of my life, and no doctors were educating me, and I wasn't really looking for the information, not really knowing what to look for, how to understand, other than it was very painful and debilitating, and, just physically just draining and exhausting, and mentally and emotionally as well. And I was pretty much on just hormonal treatment. So I had my first surgery. The surgeon said that all of my reproductive organs were all stuck together. My ovaries, my uterus, and they were also stuck to my bowels, which is very common for someone with endometriosis. I had a lot of adhesions all around my nearby organs, the lower bladder. And so they obviously had to go in and put things back to place, you know, get in there and obviously burn off the adhesions and all that not so fun stuff. So I was formally diagnosed with endometriosis, adenomyosis. My left tube, I believe she said, was just like not working at the time, which didn't make sense because apparently it does, according to my specialist. So I was diagnosed with stage 4 endometriosis after that first surgery 3 years ago. Well, my life got worse because after the surgery, I came home, I felt relief, I was fine. It was hard on me emotionally, physically, mentally. I told you guys about in my previous video how that affected me with PTSD, and it opened this whole Pandora for my emotional and mental health. You can watch that video. It's my video too, but it'll tell you what it did. Physically though, this is what happened. I was maybe a month or 2 pain-free. I was healing, at least I thought I was. There was all sorts of things happening to my mental and emotional health, but physically I was not healing. I got to a point after my post-surgery where I began to experience the worst pain yet ever I've experienced in my life. If my symptoms, when they rate them 1 to 10, you always say 10 being the worst. I used to say 13, 15 was the worst for me, right? And that's just like ER sort of pain, right? But after 15 years of dealing with this with my life, you build tolerance to pain. It's sad to say, but that's the truth. You build tolerance. You know, pain for me, still for me, it's just like, yeah, I can almost take anything. But this pain that came was just like on another level, like on another level. Like, whew, I think about it right now and I just get like emotional because I could not walk. Like, I couldn't stand to fold my clothes in the laundry room. I had to get a TENS machine to shock myself to not rather experience the shocks than the actual pain that I was experiencing. The inflammation was terrible. The pain, I mean, you guys, like, I can't even describe what I was experiencing. It was just like on another level. And that only affected my emotional, my mental health, like 10 times worse. At that time, I was very conflicted with what I wanted to target first, my emotional, my mental, or the pain. I couldn't really deal. There was a point where I was just isolating myself. I didn't know what to do. I had emailed my doctor several times. The surgeon, the pain management, physical therapy, they were all understanding of my, I guess, failed surgery, in quotations. That's how I feel about it. They didn't feel that way. But it's, how could you explain going from suffering pain 1 week, 2 weeks, a month to having pain, the worst pain every single day? And I went like that for, I don't know, maybe 3 months, 4 months before I met with a very sweet lady in the pain management department, and she recommended that I get on the IUD Mirena, and that I would have to just give it some time. And I didn't have time. So in the meantime, I was on some very strong pain medication. And I was on it 24 hours. I lived like that for maybe, I don't know, I want to say it wasn't 3 months. I want to say it was about 6 months. Yeah, about 6 months, because I was also getting very concerned that I was taking pain meds every single day, 24 hours around the clock. So as I would beat the pain, because if I wouldn't take my pain medicines on time, guys, it would take at least 2 or 3 hours for it to like kick in and save me. So I would have to beat it before I would start to experience any sort of symptoms. Otherwise, I was screwed. I would start crying or something, right? It just wasn't fun. So I was living with pain medicines. In the meantime, they were treating me with the IUD, which did take about 8 weeks or so before I started to feel a difference in the pain level. So I started to sort of bring down the dosage of my painkillers. So, if I would take, I don't know, 800 milligrams, I would start to cut 100, for every 24 hours or so, or 12 hours. I was taking 4 800 milligram pills in 24 hours. That was a lot. It was a lot. And guys, like, I know I'm lucky I'm alive and I don't have liver problems or kidney problems. I hope not. Knock on wood that I ever do. But that was concerning, obviously, because I was just like popping pain medication every single day, every 4 hours, 5 hours. When the Mirena actually kicked in, I was able to get off of it. And during that time, in the meantime, while I was giving the Mirena time, I was also contacting and looking for specialists in, the state. And I couldn't find anyone close to me. They were all, on the other side of the country. There was one in LA. Then finally I found someone close. Dr. Cameron Nezhat, I think that's how you pronounce it. I apologize, doctor. But he was out of my insurance coverage, and he actually doesn't take any sort of coverage. You have to pay cash. That was truly defeating to me. It was just so sad to me because I didn't even build a Lego. The tea is really good. Geez. I just don't want to be loud, I guess, and talk over my loud Lego building. Anyway, it was, I want to say at that time, it was about at least $3,000 to just sit and get an ultrasound and just like generic testing, like blood work and that kind of thing. And I was like, oh yeah, I don't have that kind of money. So I said, okay. I kept searching, and I found a group on Facebook. I want to say it's called Nancy Nook, or yeah, because I'm on several, so I want to make sure that's the one though. I'll probably drop it in the link if I find it. I think it is. And they had an amazing referral list of actual endometriosis. This is a support group for endometriosis, endo warrior sisters who just kind of go on there for moral support, for, suggestions and just sort of education, that kind of thing. So there's also a lot of surgeons who are part of that group and just kind of, learn from the patients or the gals that are in the group and, sort of share their stories and, but anyway, I joined that group. I found that they had a list of endometriosis specialists around the world. And I found a few here in Northern California where I'm at. And to my surprise, the first time I missed it. I did not see that there was one, or maybe they didn't have it then and they added him later. But when I checked after a few months, I noticed that there was another guy that is within my group for my insurance. And Lord and behold, I said, hallelujah. Like, I was so happy, you guys. Like, I wanted to cry. I cried again when I actually called and got a hold of them, and I learned that I had to wait like 6-7 months to see him. This guy is amazing. So he had a long wait list, but they knew how desperate I was. I kind of poured my heart out to his assistant, and I said, please look at my chart, look at my case. You guys have access. And she was like, oh my God, yeah, like, you know. She gave me an appointment, and I waited like 3 months to see him, and then he canceled my appointment. I nearly died, but I was not giving up. I said, nope, this is my only hope. Well, yeah, I got to see him after maybe 6 months or so, and I cried because he said, I hear you. He did like, you know, an in-room exam, which was extremely painful and very thorough. I mean, you could tell the difference between him and just a normal gynecologist who has absolutely no damn clue how to help you. Because this guy knew what to do, what to say. He knew all of the testing, all the ultrasound. He could almost see it and tell me, this is what's going on, this is what's going on. You know what I mean? He did tell me that the surgeon did not remove a lot of the adhesions because a lot of them were very close to my bowels. And when they're not specialists, they normally tend to just kind of do things that are at their reach, right, with the robotic instrument, and they're never really comfortable going in and doing anything deeper or anything out of what they feel comfortable doing, because obviously they don't want to put the patient's life at risk or, you know, do more damage than good. So that was my case. That's why when obviously I left the hospital, my post-surgery was obviously not successful, because I did have a lot of the endo removed, but not a lot of it. And I still had cysts left and fibroids that were, again, also in areas where non-specialists don't tend to, you know, mess around. So at that time, I was not ready mentally, emotionally. I was drained. I was experiencing, in my second video, I told you guys all my PTSD problems, all my emotional and mental health issues. And I said, okay, I feel confident. I'm so glad I got to meet you. I'm so glad we got connected. He was ready to go back and take me, but I was so traumatized from my first surgery, from everything that it caused. There was so much more negative and wrong than anything good. And the only thing good, God, I'm getting emotional, because I remember I was in a very dark place, you guys. The only thing good in those years was finding that surgeon and meeting him and getting hope for the future. I don't know why I get so emotional. I know that that whole year after the surgery, it was so hard for me. It was extremely hard. It's probably the darkest year of my life. And I was so desperate to get my health back. I think that I just wanted to focus that whole year in making sure that I was back normal emotionally and mentally, because I didn't feel like myself, and I couldn't bear going under surgery again and coming out far worse. So I was dealing with that trauma of believing again in the health system. Although I don't blame them for my childhood trauma that kind of came to surface from going under anesthesia the first time. I think that, things were meant to happen as they did for a reason. Unfortunately, I just have this chronic disease that doesn't go very well with mental and emotional challenges. It makes life far worse. So, I waited nearly 3 years, because this March would have been 3 years since my first surgery, and last November I finally got my hysterectomy after 2 years, well, a year and a half maybe, of being on the Mirena IUD, which my specialist, Dr. Ocampo, I love you, man, you saved my life. You saved this guy is amazing. I brought my mom and my husband, and we've built this relationship with him that, oh my God, only endometriosis sisters who can relate will understand how much you would value and care for an endo specialist who brings back hope and your life back, and just like, I had lost myself for, 2 years dealing with that, maybe longer, right? Because there's so many years of pain that's left. But I remember prior to my surgery in November, I was having about maybe 3 or 6 months where I reached out to him and I said, hey, I'm starting to experience pain. I don't think the IUD is helping. So he said, okay. He was like, come in, let's take a look. And yeah, sure enough, endo did its thing, kind of grew, and was again on my appendix, my lower bladder, still had things, tied together. I think my ovary was stuck to my bowel too. It was just a whole mess again, right, you guys? And so I went under, and I went in with so much confidence. I was excited too. It was a hard decision to make, because that meant that I would have to say goodbye to motherhood, which I was fine. I think doing 2 years of weekly therapy has helped a lot. I want to say that I had a period of a lot more grieving the loss of like my reproductive organs. I think I'm still grieving that in a sense. But I knew and know deep down in my heart that that is the best option for me, treatment for me. And I'm very happy I did, and I'm very happy with my decision to go forward with that. Obviously, he went in, they did a robotic. I had to have, my uterus removed through my vagina, because of the size of my uterus was enlarged, right, from the inflammation. That's also adenomyosis. So that was a big factor in the pain that I was suffering. But coming out, I have no regrets. It was, gosh, it's crazy to say that it's probably been the easiest health procedure I've had. Despite, so I was supposed to go in and have the procedure and be sent home that same day. That didn't happen because I'm very sensitive to medication, and the anesthesia was like extremely hard on me. So I think I'd stay there for about a day and a half, maybe 2 nights. Yeah. But it was just me being out and just recovering from the anesthesia. But in terms of pain, like, I was on my painkillers for like a day and a half. Like, that is unheard of. And like I said, you guys, I want to be sensitive to people who don't have the same pain tolerance that I do, because of many years of suffering pain. You build tolerance. So maybe I was experiencing pain, but for me, it was just kind of like, oh, I'm just cramping, or, it was just something like that, right? Which I was. But nothing was excruciating. I was able to walk after a few physical therapy sessions, which that was amazing too. They sent home care. I had, nurses come every other day. Like, I was so well taken care of. Physical therapy came to my home too. I was like, oh my God, like, this is so nice. I was so happy, you guys. I felt so blessed, but I almost felt like I didn't need it, but I didn't want to be like rude and like not take the help. But I was just like, wow, this is truly nice. And I just, I had my mom with me for a week and a half, 2 weeks maybe. And, she was amazing, which really helped kind of spend time with her and bond with her. We did a lot of Lego builds. But that was probably the most special part of it, just like spending time with my mom and heal. Like, we did a lot. Like, it just felt like it was an opportunity to do a lot of inner healing child too with my mom. And I don't know, just like, it was so special. Even though it was sad, and I know my mom was like very sad, and it was hard for her at the hospital because she obviously saw me kind of go through it. And I know it's not easy for a mom to see their child go through that, and especially lose their reproductive organs without being able to achieve motherhood. So I know that was very hard for her, and a lot of like my aunts and my loved ones who would have wanted me to, achieve that. I'm sorry. But in a sense, it was very healing because I was able to spend that time with my mom and share that with her and just feel her comfort just by being here and just helping me. So, gosh, I don't know why I get so emotional. I'm happy, you guys. It's a really hard thing though. I have to be very honest. Like, these things are not easy, but I'm very happy with my decision and I would not take it back. If you are debating, I would say find a specialist. Don't go with any generic OBGYN. I have respect for the medical industry, but there's a lot of lack of education within the medical profession. A lot of people in that field do not understand what endometriosis is and how to help their patients. So find a specialist. That was probably my only one regret, is not educating myself enough and not finding the first surgeon to be a specialist. That is only my only regret. But anything past that, I'm grateful for. I've learned a lot. I learned to advocate for myself and not take no for an answer. Not let a doctor say, well, too bad, there's no cure, I can't do anything for you, and gaslight me. You know what I mean? Like, there's just a lot, you guys, that you have to consider when dealing with this. So good luck. If I missed anything, please leave it in the comments. I hope I didn't sidetrack myself. I hope that I was able to share enough information where it could help you, guide you. You can relate at least, or, if it gave you a moment where you felt acknowledged and, where you're like, yeah, I'm 1 in 10 too. I've experienced the same thing, because you know what? A lot of us do. We all have the same story almost, it seems like, even though sometimes we can have different pain symptoms and all that, but pretty much 99.9% of my endo sisters, we all have that same story. My doctor gaslighted me. They thought I was crazy. They wouldn't help. Like, don't be that. Advocate for yourself. Don't allow this system to make you think that you are wrong, that you have nothing. That's not true. Periods are not supposed to be painful. Periods are not supposed to be excruciating. There is solutions, and there's answers out there. We just have to go and find them, and again, not take no for an answer. So I hope that I was able to help. If you have further questions, you can email me. You can drop your questions in the comments, and I'll do my best to answer. But always find a specialist. Always get 2 or 3 opinions, and always go by the professional. Again, I'm not a doctor. I'm not a professional. I am not making any recommendations here or anything like that, other than telling you to go find a specialist that can help you and guide you. You guys have a good night. Thank you for listening.